in the way we view our workforce for the GM Workforce Summit 2020. Just a bit of housekeeping. If you could keep your camera on where possible, so we can get more of a feel for a live event, and your mic on mute unless you've got any technical issues, then please speak up. If you raise your hand to speak when you want to contribute, then Anisha will keep an eye on raised hands. There is a video presentation in the middle, which we'll just have to run through, but feel free to raise your hand and I'll have a look at the end. And if you could use your chat function to share your thoughts and feedback, any questions throughout, and there will be a question and answer session at the end where I can have a look at the questions in the chat and answer those. Please feel free to answer the door or grab a drink if you need to. And just to let you know, although Anisha's put it in the chat, this session is being recorded. So we're just going to start off with the Who Are You section, then go on to a data viz discussion, then a short video on VWiz, then a quiz to see if you've remembered what was in the presentation, fun quiz, then question and answers, and I'll leave you with some contact info and resources for VWiz. So who are you? Well, who am I? My name is Alan Slack and I'm a Senior Workforce Analyst, Information Analyst at the Partnership. So I started working on VWiz in January 2019, but I've been working on workforce information since 2007. I've overseen an ESR Go Live project, 2 organisational mergers and the setup of an e-rostering system, along with business as usual workforce reporting. Now, I'd like to invite you to join the Slido poll. So you can either, on your mobile phone, either scan the QR code with your camera, or on any browser, log into slido.com and then enter VWiz as the event code if prompted. Now, I'll give you a few minutes for that. If anyone's having any issues with it, could you put it in the chat, please, and Anisha can let me know. Hopefully people are on Slido now. Oh, someone's saying no such event right now. If you try again, it should be live now. Is anyone else on okay? Yeah, it looks like some people are on. Zoe is now.
No.
No. Are you on your phone or on a web browser?
On my phone.
Did you scan the QR code?
No, I logged in.
Right.
I'll do that now.
Any joy, Zoe?
No. I'll keep trying.
All right, thanks. I'll start with the first poll, bit of an icebreaker. So which was the first band or artist you saw live? Hopefully everyone can have the ability to type in who that is. Eagles, McFly, Bon Jovi, INXS, 3T. Don't know. I'm not familiar with 3T. Suede, like Suede. Wet. Spice Girls. Adamant. Ooh, remember it. Chic. Big fan of Chic. Mine was actually Doctor Hook in 1980 in America, taken by my parents. Right, it's good. Quite a variety there. Okay. Next one. Which sector do you work in? So far, all public health. There's quite a variety there. Oh, don't know how many people. We've got 14 answered. So, okay, so mostly NHS trusts, I'm guessing. General practice and local authority, which is good because they're the three sectors that VWIS focus on. Next one. What do you think of workforce planning? What words or phrases come to mind with workforce planning? Essential, yeah, definitely. Critical. It's not given enough focus. Excellent, important. Very positive there. Long-term view, skills and competencies needed to meet demand. So definitely essentials coming out as the number one. BHM demands it. Right. Definitely important from that then. And now, what do you hope to get out of today's VWIS session? Just a word or a phrase, please. Ideas, excellent. Solve all my problems, please. We'll try. Awareness, better understanding. The scope of information, how it can be used, so we'll cover that. Understanding of the functionality and how it can support integrated working, yes. Good primary care workforce data. Excellent, I'll definitely be covering primary care workforce data later on. Learn something new, ideas. So ideas, more understanding of VWIS and the scope and how it can support workforce planning and integrated working. Right, if you could stay on Slido, please. I'll end those questions, but we'll be coming back to it later on. Zoe, is it working for you now?
Yeah, I've done it, thanks.
Yeah, excellent. So we're just going to have a quick data viz discussion, just generally. So I've come up with some data here, and at the moment it's just being shown as a table, which can be informative. It's easy to manipulate. Most people have access to Excel, so it has got its plus sides, but what's it really telling us? And when it's transformed into an infographic, it can really bring the data to life and highlight the story in the data. So it's showing the negative transfer balance of football clubs. So Manchester City's success came at a high price, according to this infographic. Go back to Slido now, please. And then if you could just have a look at this data viz and just give it a score out of 5. So just how it looks, what it's showing us, the story behind it. 1, right, 3, couple of 2s, low scores here. So we're roughly looking at an average of 2 out of 5. My main problem with it was the relative sizes of the bars. Especially 2017's got 21,000 immigrations, and 2018's got over twice as many, but the bars don't seem much different. So I don't know if what bias they're trying to put on it, but that was my main. I didn't think it looked too bad. Apparently didn't like the girl's dress. So now this 2012 presidential viz, what do people think of this one? 1, yeah. 3 people have gone for 1, yeah. Or someone likes it. 2. Yeah, low score. I mean, I don't like it. I don't like pie charts in general. I mean, there are only 3 categories, which is fine for a pie chart in general, but they don't even add up to 100%. No, it's not good. Not good for me. And then this one, which is a more unusual data viz called the Sankey diagram, showing how successful people are at spelling Gyllenhaal. One there. 3. 2. Oh, someone likes it, yeah. 5. Personally, I think this is quite a good one, but it did come from a website of good data visualizations. But it's definitely a lot down to personal preference of what people think about these. We'll be coming back to Slido again after this presentation for a quick quiz to see what you've picked up from the VWiz presentation. So I'll just start this off. It's a video.
Hello, and thank you for listening to this presentation on the Virtual Workforce Information System, or VWiz. My name is Alan Slack, and hopefully this short video will introduce you to the ideas behind VWiz and demonstrate the work of the VWiz project team since 2019. Before we start, a quick note on VWiz. When we talk about VWiz and refer to the VWiz process, we are referring both to the end user product and the systems and processes that have been developed in the back end to allow us to portray the data and information, as you can see here. The VWiz tool is designed to collate workforce information from across organizations which either deploy staff or directly employ staff, which sit within the emerging local care organizations or the integrated out-of-hospital health and social care workforce. The tool itself is based in Tableau, which, for those not familiar with it, is a business intelligence and data visualization tool similar to Power BI. The aim of VWiz is to support decision makers, workforce planners, and senior stakeholders from across the system to understand the shape and composition of their workforce. The reason we wanted to create a tool which demonstrates the workforce of only these integrated teams is because local care organisations are typically comprised of a number of statutory providers. These providers employ staff across health and social care and general practice, and so workforce reporting takes place within an organisation using its own systems and processes. Therefore, there isn't a mechanism that amalgamates this data to provide a comprehensive view of the workforce. In line with the NHS long-term plan, it is imperative that health and social care organisations work together to support their communities and staff. This starts with understanding the baseline and developing a single version of the truth. The benefit of using Tableau to create this tool is so that we can collect line-level data from participating organisations and amalgamate it into one visualisation. The VWIS project commenced in January 2019 with an ambitious plan and a vision to develop a useful tool which would be low resource for the localities which would like to use it. The delivery schedule has been adapted over the lifetime of the project as huge amounts of new information has been gathered and developments and transformations have taken place, and the onboarding process now only takes 4 weeks from the locality initialization meeting to end users having access to the VWIS tool. The key work streams are divided into 3 areas: system engagement and collaboration, information governance, and technical development. System engagement has been a key activity within both the pilot sites of Manchester and Bolton and also across the wider system. Through this work stream, we're now able to identify necessary data, spot problems early on, identify critical stakeholders, and understand the complexities of the data sharing. Information governance has been one of the biggest challenges and areas of learning for the project, and to date we've worked in collaboration with MFT and Manchester Council to create robust agreements, documentation and processes for trust and local authorities. The learning that's come from this piece of work has been shared with parties across the wider system, allowing viewers to support and feed into other strategies and projects. The development of the actual tool has relied heavily on engagement and information governance due to the complex web of interconnectivity and the granularity of the subject matter. The team has now created a complete end-to-end process from developing a data specification upload template and visualizations to ensuring there is guidance and information in place to support localities and organizations to use the tool. This system documentation and process can be lifted and shifted to new localities while work continues to ensure end users are trained and can access the tool. This slide provides a quick demonstration of the VWIS tool from the perspective of an end user. As you can see, the tool is easy to log into from a link using a web browser. Users click the request access link on first use and are then allocated the necessary permissions and viewing rights for the appropriate localities. The user then navigates to the VWIS workbook
No, I'm all right, thanks.
and then to the views within this workbook. The landing page displays this map of GM localities showing which are currently submitting data to the tool and the organisations and FTEs which make up each locality and the current VWIS dataset. At the bottom of this view is a link to some Tableau training videos. These videos will support the viewer-specific guidance created by the project team and should hopefully enable as many users as possible to get to grips with Tableau quickly, even if they haven't used it before. The headings across the top of the page are various views that have been created from the data items collected by the bespoke collection mechanisms for VWIS. Further guidance and explanation relating to each view can be found by hovering over the information icon in the top left-hand corner of the view. This first view shows the workforce baseline for the combined health, social care and general practice workforce in Greater Manchester, and provides an example of the manipulations and interactions that are possible for the end user. At the top of the view are a variety of filters which can be altered to slice and dice the data in a variety of ways, allowing the end user to drill down to answer specific questions about the integrated workforce. The first two charts show the FTE of the integrated workforce split by sector in a donut chart, and a line chart showing the FTE and headcount over time. One of the nice features in Tableau is the tooltips, which appear to give extra information and intelligence about areas and data points on charts and tables. The charts below show a split by sector and staff group, and also the gender split by age band. Each locality can be assigned a number of super users, which will see a Manage Users button to allow them to give new users access to view and interact with their locality's aggregated data in VWiz. VWiz has low number suppression throughout all views so that individuals cannot be identified. This view demonstrates one of the planning support aspects of the Viewers tool. Here we have generated an interactive dashboard which displays the FTE and percentage of staff from an area or within a specific job role that could retire within a certain number of years. In this view, both the age and the years to retirement can be changed by the user. This provides localities with a view of how many staff could potentially retire in any given number of years, and so allow for some succession planning to take place. There are highlight metrics down the right-hand side, and further down are charts showing age distribution, gender split, nationality, and BAME splits to help ensure that the workforce is representative of the local community. This view shows the aspirations of VWiz to have the ability to demonstrate the local care organisations across GM with a breakdown of the staff working within a specific neighbourhood. Here we have general practice staff which can be interrogated at a locality, neighbourhood or primary care network level. The filters can be used to drill down here to a specific locality. These different shaded areas are all different neighbourhoods of Stockport. Here you can see different metrics on the right-hand side of the screen which provide specific intelligence. For example, the percent of staff aged 55 and over. Below this, we have age band, GP country of qualification charts, and then further detail at practice and job role or staff group level. Thank you for listening, and I hope this whistle-stop tour of VWiz has broadened your understanding of the tool and processes involved, and given you some awareness of the intelligence and insights possible through the interactive visualizations we have created. Hello.
Thanks for listening to that. Hopefully that's broadened your understanding of VWiz somewhat. Now, if we could go back to Slido, please, it's just a short fun quiz with a few questions about the presentation on it. Hopefully everyone's on now. So when you go to the quiz, it'll ask you for a name that will appear on the screen, and then I think you click join and you should be in the quiz. Hello Zoe, Ros, Myra, Kirsty, Alice, Simon. I've lost track now. We're down to 10 now. Anyone still to join? No? Okay. Let's start the quiz. So what data visualization product does VWiz use? Is it Power BI, ClickView, Tableau, or Excel? One, zero. Tableau, everyone got that right. Oh, yeah, correct answer, yes. Thank you. I don't know what the leaderboard will look like now. Everyone at number 1. Oh, it's gone alphabetical, is it? Next question. How long does the onboarding process now take? Is it 4 weeks, 4 months, or 4 days? Oh, yeah, 4 weeks. Someone thought 4 days. I wish it was 4 days. It'd be a lot of work in 4 days, but no, it's 4 weeks currently. Next question. Right, which of these was not a pilot locality for VWiz? Bolton, Wigan, or Manchester? 4, 3, 2, 1. Let's see the answers. Everyone got that right. Well done, people really listening. 100. So yeah, it's still quite a few people with 3 out of 3 still. Oh, it's gone on time, hasn't it? So 14 seconds, number 1, Louise. What application do you use to access VWiz? Tableau licensed product, Outlook, Excel, or web browser? Right, so some people think Excel, some Tableau licensed products. It's actually a web browser, so there's no need to buy any licenses to access VWiz. Just use a web browser, and that means it'll be free for localities who signed up before March 2021. How many different views does VWiz currently contain? Slightly trickier one, 6, 7, 8, or 9. And 6 is the correct answer. Let's see the leaderboard. Oh, quite a few people, 5 out of 5, but quickest is Louise. Last question. Which VWiz workstream posed the biggest challenges and areas of learning for the project? Let's have a look. Big shout for information governance there. And it was information governance. So now even though we've gone through the initial pain of information governance processes, we've got documents and processes both for trusts and local authorities, which can be adapted and transferred to new localities. And the final results are Louise. Quite a few people got them all right, so glad to see people paying attention. Louise was the quickest, so well done, Louise. Right, that's it for Slido for today. Over to question and answer session. I'll just stop sharing the screen a minute so that I can have a look at the chat. Have a look. Has anyone put anything on Slido? Will there be a charge after March 2021? I mean, if you don't have it implemented before then? Well, year 2 is drawing to a close in March 2021, with year 3 focusing on general practice. So I'm not sure what the arrangements will be after March 2021, but it's definitely free until then. Can we have access to the IG agreements, please, from Julie? I'll check with my manager, the program manager for VWIS. I would imagine they'd be willing to share them, but I'll certainly take that away. Can we get access to have a look at the dashboard, James? Where all I can see James as a guest. Where do you work, James? Some areas, for example, general practice data at the minute is just publicly available data, so we can definitely share that.
I don't know if her answer has been, her question has been answered, but Louise did have her hand up.
Sorry, come on, Louise.
Sorry, I've just put it into the text. Really, I suppose what I was interested in, has there been any evaluation of the impact in the 3 localities that it's been put into, Alan?
We're still in the we're still handing out training dates for Manchester, Tameside and Bolton. So there hasn't been any impact yet. Do you mean impact on the workforce department, or impact on the?
I suppose impact on that system-wide workforce planning, because I think for me, obviously, we're quite far down the line at Trafford, and I'm looking at trying to get it in sooner rather than later. And I think I'm just trying to work out in practice who is using this information then to do something, because there's a lot of different players in the mix, isn't there, then to do something about different parts of the workforce. So I was just wondering, it sounds like people are not that far down the line. So who's being trained then in Manchester and the other areas?
At the moment, it's just like the very senior people who know how to use it. It's been used in an integrated workforce planning project for Manchester with neighbourhood level meetings. So they're taking VWIS data and visualizations to those with the neighbourhood leads. Yeah, but we're still training people. It has been a long process to get the information governance signed off and refined and accepted, really. That's been the major stumbling block.
Thanks.
Is there a list of the types of information that can be drawn? So Moira, yeah, so got workforce numbers, demographics, got succession planning, turnover, absence and appraisals. So the areas we get data on are staff details, leavers, appraisals, absences and professional registrations.
Right, it's just because if this is to be promoted, obviously, amongst the managers, we need to be sort of telling them this is what it can do. So it was just to have that information about this is the type of information that goes in the system, and therefore we'll be able to get some good data from it. So it was just about that really, Alan, about, you know, is there a list of, rather than just saying we can get the age out of it, etc. We could use it for a more wider set of stats, if you like.
I've got a good comms pack that I don't know if you've seen it.
No, I haven't.
It's got that sort of information in it.
That'd be really useful if you could share that with us.
Yeah, definitely.
Thank you.
Kirsty Roberts has got a hand up.
When will you start engagement with general practice? Is that what you wanted to ask, Kirsty, with your hand up as well?
No, it was a bit of a follow-up. You were obviously talking about the Manchester pilot and the engagement with neighbourhood leads, but I'm presuming that's from an LCO point of view and not necessarily primary care, because I'm not in it in a Manchester point of view, and I know it's led by John Lenny from the LCO, but that doesn't engage primary care, and I just wondered when that will happen. Because obviously we're kind of moving ahead with workforce planning across neighbourhoods and things like that. So just to ensure that I'm involved as the workforce lead for primary care in Manchester.
Yeah, I mean, we have got the primary care data from NHS Digital at the minute.
Yeah, I knew that was kind of in there. But I mean, in terms of practices, getting them to understand it and use it. Yeah,
that's going to be the focus of year 3 from March 2021.
Okay. That's fine. Okay, thanks.
Is there a schedule when the latest information is available on the system each month from Moira? Yeah, well, basically the deadlines for submitting the monthly extracts are the end of the following month, and then it'll be refreshed the following day.
So the end of the month's the best time to draw the data, is it? Or the first week of the month?
It depends on the processes in your organisation.
Right.
So it depends on your inputting and when you think the data will be up to date. But so for September's data, for example, that needs to be submitted by the end of October, and then the system will be refreshed on the 1st of November.
Right. So it's our workforce intelligence team, isn't it, then, that'll have the schedule of when they provide stuff for VWIS?
Yeah.
Right. Okay. Thanks.
How will we engage general practice? Have I already answered that for you, Kirsty?
Yeah, you have, yes. Yeah, I've just put another question in the box, sorry. It's more in relation to the workforce data. I know we've been talking for a number of months around supporting general practice, because obviously the accuracy of workforce data is not great in primary care, and what support is available to support practices with that, because it's changed over the last 12 months, maybe 18 months, how that's reported. It was meant to be less onerous. I think it's become more onerous, and it's just quite difficult to make sure we get how we can get accurate information from practices, and if there's been any discussions so that we can improve the data that we've got to inform workforce planning.
Yeah, I know. I know it is difficult especially when data isn't particularly pay affecting, to have it up to date and accurate. But can we have a meeting to discuss this some other time, Kirsty?
Yeah, sure.
Just aware we're running out of time, but I'm happy to have a meeting with you. Yeah. And then Julie Wilson, I'm happy to set up a meeting with you as well if you want to discuss how we can use this, how you can use this, sorry.
That'd be fabulous, Alan, thank you.
Yeah. I'll put the contact details up on the slide, and contact details slide up in a minute. So.
Thank you.
The training is delivered by the programme team, yes. Yeah, virtually at the minute, obviously, but yeah. I'll just share my screen a minute so I can leave the contact details up. So yeah, you're best getting in touch with me or emailing the viewers inbox. I'm sure John will pass any communications on to me, but yeah. So thank you very much for your time. I hope the session was useful. I hope you enjoyed it. And I think it's going on the Workforce Futures Centre. So I don't know, Anisha, will a link be emailed out for that?
So the link is in the top of the chat, and then it will get circulated amongst groups as well for it to be circulated further.
All right, thanks. Thank you. Enjoy the rest of your day.